So we heard what people said, we looked at statistics, we talked to people, we talked to focus groups, we talked to clients that are in the system now, and felt that we needed more than one-stop shopping, we needed more than a variety of silos. We need all of the services all together, work with the police, work with our service partners to actually make it so that when a person is in the throes of an addiction and reaches out for help, we're there and we can actually make a change in their life. So withdrawal management in our community, we need to do a few things. We need withdrawal management to provide easy access to information for people who are looking for help, for their families, and for their employers. We absolutely need to reduce the visits and the repeat visits to our ER. We need to reduce the number of people who are arrested for public intoxication and going to jail. We need to reduce the criminality, the disruption in our community that drug and alcohol are causing. We need to reduce the use of other services for withdrawal. And we have to enable appropriate care for people who need a specialized kind of help in the proper resource. So I'm going to go a few minutes now and talk to you about the withdrawal management components, parts of the program that we put together. The first part is the day withdrawal. And day withdrawal is basically daily groups to deal with issues for people in withdrawal who are dealing with addictions. This service has a walk-in format. You don't have to phone someone and get a call back who makes another call to get to an appointment. It's a walk-in format that's mobile. We'll have groups at different locations in the community. And we've already spoken and are starting to work with the Inn of the Good Shepherd, Bluewater Methadone Clinic, Lambton Public Health, and First Nations communities in Stony Point and Andronong to develop day programs. The day program, the Day Withdrawal Management Program, will address the difficulty in accessing information and bring support to a wide variety of clients throughout the community. Day withdrawal support, withdrawal management support, provides early education for many people about the symptoms that they're experiencing while they're withdrawing, coping and self-protective behavior strategies, example harm reduction, aftercare, and how to stabilize their lives. There's relaxation techniques. There's mindfulness about recovery and managing your life. There's auricular acupuncture, and there's learning basic life skills. And this component also allows for family support groups, because often it's the family who suffers just as much as the person who has the addiction. The next component or level is community withdrawal. Community withdrawal management support is where the worker actually goes into the community and works with folks in their home, as long as it's a safe environment, or at various locations in the community. It's the worker that moves. This service will address the differing needs of clients to withdraw in their own home or safe environment, those people who are facing barriers to access service. Particularly, and this is a need for all of these different categories, if you like, of people in our community, people with child care responsibilities, people who can't leave their children and go to a residential treatment, youth who need a particular kind of service, seniors who typically don't like to leave their homes, people in First Nations who look for culturally safe techniques and environment, and people who don't do well in group or residential settings, people who've suffered from post-traumatic stress. Certainly community withdrawal, when it's the counselor that moves, gives us greater accessibility into the rural regions, and as I said, our services can be youth specific. We will be using tele-withdrawal, and this will allow us to leverage the community withdrawal worker even farther into the community, because with OTN and actually Skype and home computers on a safe band, if you like, we'll be able to get even farther afield and into people's homes and reach out to people who truly can't get to us. The last level, if you like, is residential withdrawal, and that is bedded services. And it's the bedded services that that allow us to closely monitor the physical and psychological symptoms of people who are in withdrawal 24 hours a day, 7 days a week. Residential withdrawal service never closes. These are the beds and the services that will allow us to address the inappropriate use of health and other services for withdrawal and intoxication. We will increase the ability of people to safely withdraw. They'll be able to, for a time being anyways, get out of an unsafe environment. We'll be able to work with our folks 24/7, so it's not office hours. People who are in a crisis, not usually related to addictions, it's not a 9 to 5 kind of thing. It's whenever it happens. And so being open 24/7, being available at the end of the phone line, or actually coming in and meeting with the counselor is something that will be of great use. We will reduce the inappropriate use of the more costly resources. People won't come to the ER and stay. They might come to the ER, be medically cleared, and then transferred over to the withdrawal management. And it will increase the safe and secure housing capacity of Sarnia Lambton. We don't have a lot of safe beds. We don't have a lot of safe housing in Sarnia Lambton. So with this service, we'll increase the number of safe beds. We'll increase the opportunities for people who are in a crisis situation to get some help. Make lifestyle changes in a structured and stable environment. The last component are stabilization beds. And stabilization beds provide safe beds or housing options while people are waiting to go to treatment, after they come home from treatment, or when they're looking to make a lifestyle change. And this is a place for people to practice new life skills and safety and feel success, feel hope, feel proudness of the changes that they've made in their lives. The last piece that I want to talk to you about as far as the service are the related services. And this is a population health approach. This is something that, frankly, Sarnia Lambton is adding into the mix that it doesn't really exist in other regions. And that's because we're trying to get people at the front end, at the beginning of the wave, rather than to wait until they have a complex disease or sickness that needs to be changed, that needs to more complicated and expensive help. And these services will be nested certainly in all levels of withdrawal management, and we're hoping to work with our service partners, example the police, housing, income support, to use some of the techniques and services that we're developing in the way they deliver services. And basically the SPURT, it's a one-page questionnaire, for example, where we give it to a person and they do it, and sometimes they can twig that, oh gee, maybe I do have a problem, maybe I do need to get some help. Certainly the outreach component, education. As I said, we've got youth, younger youth, more dangerous use of drugs. Getting out and talking about addictions and the dangers is something that this community needs and that withdrawal management can do quite well. And then there are the wraparound services. Again, it's one of the things about withdrawal management is you try and avoid the silo effect, go here, go there. People who are in the throes of addiction and mental health, they're not functioning like it to the extent that we want them to pick door A, pick door B. Have it all together. It's a much more healthy and frankly accessible service. So we would look at walk-in clinics to look at the problems that are people facing with hepatitis C, teach them about harm reduction measures, needle exchange, have some groups, concurrent disorders, and have some community addiction services. So a real mix of services. So how much, where, how many? We come up with an integrated withdrawal management program. Sarnia needs all of those services. The bedded services, the residential and the stabilization, 10 residential beds, 6 for men, 4 for women, in a co-located facility, 3 stabilization beds for men, 3 stabilization beds for women. The non-bedded services, the day withdrawal that I talked about, and the community withdrawal management, including the tele-withdrawal. The wraparound services related to withdrawal management, and the prevention and health promotion. Located at one location, welcoming, with easy access, green space, a place where you can relax, with ample parking and frankly room to grow. And as the folks have said ahead of me, it's important to have to start quickly. The capital planning process takes a couple years, the building. So we need to get going quickly. So the day and the community and certain wraparound services will be implemented quickly within the next 6 months while we're securing a final location and the capital funding requirements for the construction and ensuring the complete operations of the full program. Addiction is not addiction is a disease. Addiction is heavy substance use or abuse or dependence that frequently co-occurs with mental health problems, physical illness, and a range of social needs. It's not one person making a bad choice. Typically, there are 3 dimensions that's important to remember when you're talking about addictions. Acuity, when an addict will take a sudden risk or with an adverse consequence that could result in an accident or criminal behavior. There's chronicity, that's along with the addiction, the addict typically has enduring conditions like hepatitis C or serious mental illnesses that could worsen or develop. And it's always a complex situation. And the last one is the complexity. It's a co-occurrence of the addiction. So the problem of addiction co-occurs with something like homelessness or family dysfunctionality. It's not an easy fix to help someone with addictions. And withdrawal management is not treatment. It's not the solution. It's not a magic bullet. It's assistance with someone for a voluntary withdrawal from alcohol or other drugs, and when they come in, they're either intoxicated, in withdrawal, or in a crisis. Withdrawal management also supports people who want to withdraw or stop from a gambling addiction. And basically, we work with the client to foster a readiness for change. That could mean changing, harm reduction, reducing their use, changing their use, or entry into a substance abuse system. And as you can see on the bottom referrals, there's a variety of people who can refer a person to withdrawal management. We have a vulnerable population in Sarnia, Lambton, and the surrounding area. We have many people who are homeless or are living in unsafe environments with little or no hope of moving away to make a lifestyle change. Mayor Bradley talked about a person who lost their battle. We have significant drug and alcohol use in the Sarnia-Lambton region, and many times people are using one or more drugs together. People in Sarnia-Lambton have a number of mental health problems, and frankly, these issues are growing. We have many youth who are using drugs at a younger age and in a more dangerous fashion. So these people have urgent needs. They need addiction treatment or support to make healthy changes in their lifestyle. They need information about harm reduction and treatment options. Our general population needs education about addictions, what it is, and we have to work as a community and as a hospital and as a group on destigmatizing addictions. We need to develop education for the prevention and the promotion of health and teach people about the dangers of drug use. And these people who are vulnerable with urgent needs are facing barriers to addiction services in Sarnia-Lambton. Frankly, we have few local treatment services. And the services that we do have, social services, are being used for withdrawal management. I'm talking about our shelters, our emergency room, the jails, and other social services and peer support groups like AA. So that's the situation in Sarnia-Lambton. So thank you, Mr. Switzer, for your good work and leadership. Thank you to our chair, Stefan. Thank you to Bluewater Health. Thank you to the mayor and the warden. And I'd like to close with a heartfelt thank you to all the people who I spoke to over these last months and who participated in our focus groups and answered our questionnaires. Your truthfulness and often your moving situations are at the heart of the work that we did, and frankly, they're the foundation for the Integrated Withdrawal Management Program. Thank you.